In this video, I want to talk about the muscles of the torso. Some of the muscles, superficial chest, are actually for movement of the upper extremity. Then after we remove the superficial chest, we'll look at the intercostal muscles, muscles for breathing, and then we will move into muscles of the abdomen. So let's start with the superficial chest. Superficial chest really has three muscles. We have the Pectoralis Major muscle, which is a large convergent muscle, has origin off of the anterior clavicle and the sternum and the first 6 ribs, and it will insert out into the humerus on the lateral lip of the intertubercular groove. Pectoralis Major functions as an adductor and a flexor of the arm. If I remove the Pectoralis Major, we can see underneath Pectoralis Major the Pectoralis Minor muscle. Pectoralis Minor muscle is also for movement of the upper extremity. It has origin from ribs 2, 3, 4, and on this model 5, but usually we see a 3-slip Pectoralis Minor, but there is mild variation, so this is acceptable. But notice the Pectoralis Minor origin from the ribs, but insertion not on the arm or the humerus, but on the coracoid process of the scapula, where it functions to pull the scapula forward. So Pectoralis Major, Pectoralis Minor, muscles for movement of the scapula. Now if I rotate this model somewhat laterally, I can see coming around from the anterior medial border of the scapula and inserting into the ribs in sort of a tooth-like fashion the muscle fibers of the serratus anterior muscle. Serrated means tooth-like, and you can see the tooth-like edge of the serratus anterior muscle, which comes from the scapula. Again, that muscle is a muscle for movement of the scapula. It is not actually a primary muscle for breathing. However, it can be used for movement of the ribs during respiration if the scapula is fixed. If we look deep to those muscles, I can see that there are muscles between the ribs known as intercostal muscles. Now this torso model doesn't do the best depiction of the intercostal muscles. To learn your intercostal muscles, you have to follow the fiber directions. The fiber directions of the external intercostal muscles are down and in, whereas the fiber muscles or fiber directions of the internal intercostal muscles are up and in. We say inferomedial versus superomedial. Now the external intercostal muscles do not make it all the way to the sternum. There is a membranous connective tissue between them and the sternum. So they did that a little bit right on this torso model. Here we can see some fiber direction down and in. This is an external intercostal muscle. We should see some here, 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 and we do see some here, but they've really worked them quite a bit laterally. Here's some external intercostal, here's some more, here's some more. They should make it more medially than what is shown on this model. The internal intercostal muscles then are deep to those, and their fiber direction is described as superomedial, or going up into the sternum and the next set of ribs. External intercostal muscles are muscles of inspiration, muscles which allow you to breathe in. The internal intercostal muscles are muscles of expiration, for breathing out. Moving down into the abdominal cavity, we can see on the right side of this torso there's a muscle that is covered in the abdominal cavity by what is known as the rectus sheath, a sheet of connective tissue overlying the Rectus Abdominis muscle. On the left side of this torso, they have removed the rectus sheath so you can see the muscle portions of the Rectus Abdominis muscle. Rectus Abdominis muscle has origin down at the body of the pubic bone and the pubic crest. It actually inserts into the sternum at the xiphoid process, the sternum, and the lower ribs 5, 6, 7, maybe even the costal cartilages of rib 8. Rectus Abdominis does something that most of our other muscles do not do. It has what are called tendinous intersections along the way. This is not actually an insertion point. We have a muscle belly, then a tendinous intersection. Another muscle belly, and a tendinous intersection. And again, and again. This is what, if you are in shape, if you haven't spackled it over with subcutaneous fat, gives your abdomen that six-pack abs that they talk about in the gym. However, if you count, there certainly would not be six-pack, but the rippling. So I would prefer to say the washboard abs. But notice if I were to skin a cadaver, I would not see the rectus abdominis initially because it is underneath this connective tissue sheath called the rectus sheath. Now, lateral to the edge of the rectus sheath, we will see where the rectus sheath ends is an area known as the linea semilunaris. Now we can see the abdominal musculature. We have 3 layers of abdominal musculature laterally. We have the external abdominal oblique. Like the external intercostal muscles, its fiber direction is described as running down and in, or inferomedially. So we can see the fiber direction here of the external abdominal obliques. The internal abdominal obliques, like the internal intercostals, is described as running superomedial, or up and in. So if I rotate to this left side of this torso model, we can see here the fiber direction is up and in. So that tells us that on this model, not only did they remove the rectus sheath on this side, they have also removed the external abdominal oblique muscle. So we can tell because the fiber direction is up and in. This must be the internal abdominal oblique muscle. There is one more muscle of the abdominal wall. It is called the Transversus Abdominus. Its fiber direction runs directly across, or transversely across the abdomen. So if I remove the breastplate from this torso model, we should be able to see the fiber direction of the Transversus Abdominus. And here we can see posteriorly the rectus sheath, and we can see a fiber direction going crosswise. That is Transversus Abdominis. Now if we look into the posterior portion of this abdominal cavity, and if you can see carefully, on this side we have 3 layers. We have the external abdominal oblique, the internal abdominal oblique, and the Transversus Abdominis. On this side, they only show us 2 layers. Remember, we've removed the external abdominal oblique, so here we see the internal abdominal oblique, I know, because following the fiber direction, superomedially, and the Transversus Abdominis. Now the abdominal wall also has muscles posteriorly. It's called the posterior abdominal wall, and in this model we can see on the posterior abdominal wall the quadratus lumborum, a 4-sided shaped muscle in the posterior abdominal wall. We can see right next to the quadratus lumborum the psoas major muscle. The psoas major muscle runs from vertebrae T12 all the way down to L5 and their spinous processes, and then crosses anteriorly to the pelvis to actually be a muscle used for moving the lower extremity. So this muscle inside our posterior abdominal wall actually flexes at the hip. There is a psoas minor muscle. Psoas minor muscle is absent in roughly 40% of people. It is a small muscle. It only inserts into the pelvis, so if you don't have a psoas minor muscle, it is not of great consequence. And then the last muscle, which is posterior abdominal wall, is the iliacus muscle. The iliacus muscle comes from the iliac fossa and joins the psoas major to become what is known as the iliopsoas muscle. So iliacus also functions for flexion at the hip.